we decided to move the whole thing outdoors. But if you hear a little screaming, we're competing with a daycare center off my right shoulder here, and the pediatric crowd sometimes gets a little bit loud. So just bear with us for a little bit. I wanted to spend a little time this morning talking about a couple of issues that have come up in the past few months in my practice about patients and surgery and timing and that kind of thing. The first is I will often get patients who come in for an initial consult who want to have one of the operations that I specialize in, breast augmentation, tummies, and so forth, because they have a special event coming up, a wedding, a cruise, a vacation of some kind. So they want to spruce up for it, but you know, the wedding's in 3 weeks, and so could I just squeeze them in this week to have the operation? No, I can't. I'm booked out a little further than that. So if you, the first rule here is if you are interested in having some type of cosmetic procedure, plan a little bit ahead for this thing, okay? I mean, if you got a wedding coming up that you want, you're participating in, you really ought to give it at least 2 months, sometimes even 3 if you really want to be safe, to avoid there to be a problem here. So you just, you know, plan ahead a little bit. The second is, so that's the lead time aspect of things. The second is plan ahead for the downtime. You know, some operations, the post-op recovery is a little quicker than others. And if you have a job that does not involve sitting at a desk, it may be that you're going to have to take some time off. When I do breast augmentation on the hairstylists, they cannot be lifting their arms up for 2.5 weeks. You need to afford enough time to take off to accommodate that restriction. Tummy tucks. I don't want people lifting anything heavier than their shoes or their purse for at least 3 weeks. So, you know, if you're a forklift driver or you deliver for UPS, you know, that's just not going to work. So you got to plan this out a little bit. Be aware of those kind of things. If you're planning or trying to lose weight, I always recommend you do that first. And when you hit your target, or you hit the wall and you can't go any further, that's the time to do body recontouring, because otherwise I'm trying to hit a moving target and I can't do that. It's just not a good idea. So, you know, you got to plan ahead a little bit. I'm always happy to talk to people. If you're planning to lose weight and you want to come in for a consult now, fine, that's good. I have no problems with that. But you don't expect me to be operating on you anytime soon until you're at a stable weight. Similar with smoking. There are certain operations that I will do on folks who smoke, and there are certain operations I won't. It's the larger operations, the tummy tucks, the breast lifts, the breast reductions, that kind of thing, that have a large scar that I will not do on smokers. You need to stop smoking for at least 2 months before I'll be willing to operate on you. Now, this is not punitive. It's simply a good medicine. Smoking inhibits wound healing, and I don't want a problem with wound healing, because if you have a problem with wound healing, you're going to have a lousy scar. And these operations have, you know, long incisions, and long incisions can have bad scarring, and I don't want that to happen. I'm a plastic surgeon. Go sue me, but I don't like a scar. That's why I'm a plastic surgeon. So you gotta watch that. I've had a couple patients who want to travel here from out of state, even couple from out of the country, to have their surgery done with me. I'm flattered, but I don't think that's a very good idea. First of all, you have to be here. For many of the operations, you need to be in town for at least 6 weeks. I want you here. From the time of the initial consult to the time of the second post-op visit, that's about 6 weeks. And, you know, if there's any problems at all, I need to know about it, and I need to be able to see you and treat you. You know, if you're coming, if you want to have one of the surgeries I perform and you're coming from a long distance, you know, as I say, I'm flattered, but there are other surgeons that I'm sure are a little closer to home who could take care of you. Maybe not as well, but what can I say? Now, that brings us to the last one, what we call comorbidities. You have to be healthy enough to undergo this type of surgery. This is not heart surgery. This is not brain surgery. This is elective surgery. And I am not willing to take risks with people's lives or their health in order to do it. We have a fully accredited surgery center, but we're not a hospital. We can't admit you. You can't be, if something happens, some catastrophic, we're out in an outpatient surgery center. So you have to be in pretty good shape to undergo elective cosmetic surgery. A number of things that we simply will not do, and it's, again, not punitive. We just want to do this in the safest possible manner. We won't do a cosmetic surgery in an outpatient setting on someone who's older than 75. It's just not safe. You need to be somewhere closer to a hospital to do that. You can still have the surgery, just not here. If you're having any issues with your lungs or your heart that require medicines any stronger than say a mild blood pressure medication, probably not going to end up having your surgery done here either. Any blood pressure issues have to be in very good control and will probably require a letter from your cardiologist. Similarly with diabetes. First of all, I probably am not going to operate on you for type 1 if you're requiring a lot of insulin. Type 2, if you're just on medications, it has to be, again, the hemoglobin A1Cs have to be in pretty good control, and we probably are going to require a letter from your regular physician for that kind of thing. Obviously, if you're having any blood issues, any clotting issues, have a history of this kind of thing in the family, something called malignant hyperthermia. These are all problems that can result in severe complications. And, I'm just getting too old to take risks with people's lives, so I'm just not going to do you. Okay? So, and finally, if you've had issues with narcotic medications and you're on, for instance, an agonist, antagonist, such as Suboxone, we're just not going to do that. It's just too difficult to manage the anesthesia in patients like that. So the bottom line is you need to really tune up if you're having any medical issues. These have to be in pretty good control before I am willing to take a risk with you. I often tell people, if I wouldn't do it on my wife, my sister, or my daughter, I'm not going to do it on you. So that's the bottom line. Well, I hope some of you will be able to get out at least and enjoy this wonderful day. Till next time, Dr. Thomas Bartell, so long.